Aaron kind of mentioned this is a whole new thing that we're kind of approaching. It's mandated by the NCAA and our WAC conference too at the same time. So we're really pushing towards educating everyone involved in athletics. So not only the student athletes, we have staff going through this education too, GAs, pretty much anyone involved. That way we can really spread the word on concussions and what's to come. So just kind of start off, how many people have had a concussion before? Okay. So you guys have, yeah, one current kind of thing. But yes, like we kind of said, concussion, it's huge now in the news with all this new and latest research coming out. And we're really trying to push, making sure everyone kind of knows what's to come. And my big aspect of this whole presentation is to make sure you know what's the return to play. So after you suffer a concussion, what's to come and what are those next steps. So to start off, what a concussion is, really it's a brain injury. It's an alteration in the brain function. So think of if you were to get hit in the arm, you're going to bruise. You get blood flow to that area, you get that damage of those tissues. Pretty much the same thing with a concussion. I like to explain where you have your skull, and it's a very hard, protective thing, but then you have your brain inside. And your brain kind of like floats around with fluid and kind of protects it. But a lot of times if you have damage to that brain, it's going to hit up against that skull, causing that bruising, causing some of those cognitive dysfunctions, everything else. So when it comes to a concussion, it can be a blow to the head, so it could be a direct blow. Maybe you get hit with a ball, hit with a bat, a golf club. Or it could be kind of like a blow to the body. A lot of times people will get a blow to the body and they have a whiplash effect on their brain. So like I said, the brain kind of floats around in the fluid. If you get a whiplash, it's going to smash up against that skull. So just know that you don't have to suffer a direct blow to your head to kind of suffer that concussion. And the big thing that we like to talk about is that concussions don't always happen in athletics. You could be hit by a car, I hate to say it, or in a car accident, but all those other different situations. We've had student athletes in the past hit their head on their bunk beds and suffer concussion that way. So don't just think it's all sport-related, practice, or game-related. It can happen outside of that. And then another big aspect that we like to talk about is the lack of consciousness. You don't always have to lose consciousness or black out to have a concussion. You can stay completely conscious the whole time, but still go through those kind of damaging factors that kind of lead to it. And another thing, there is no partial concussion either. Once you're diagnosed with a concussion, we have to start that return to play. A lot of times people will say it's just a mild one or a moderate one. And really we're kind of getting away from that and just saying a concussion's a concussion and we're going to treat it the same way. And then the big thing that we like to talk about is that every concussion is different. People have explained concussions as snowflakes. Not one is ever the same. It depends on you, depends on your recovery time, what you do to recover, what you kind of experience. So just know if you have a concussion and your teammate has one too, it's not going to be the same. The return to play is not going to be the same either. So why it's important to identify and treat concussions. If we do not prevent or we do not treat these concussions, it can lead to further injury or even death too. You can die from complications of a concussion, and that's why we really want to educate everyone to see those signs before it gets to that point. About 15% of concussions have symptoms that last longer than a year. So that means that we can deal with really long-term effects from these concussions. And that's why we really want to prevent anything from happening in the future. Our big thing that we want to prevent is what we call second impact syndrome. And that's where if you have a concussion and your brain is not completely healed, you were to get hit again. So it's like a concussion after concussion. That's way more serious and severe than any other situation. And that's where we can lead into some possible death situations, everything like that. So we really want to stress that we return you to play safely, you're cleared, you no longer have any issues, and then it's safe to kind of continue playing. We also have a lot of research out there nowadays that are talking about long-term complications, so depression, anxiety. You've heard about CTE in the news too. They're starting to do research that anyone from boxers to BMX bike riders have this long-term effect of concussions on the brain. So hopefully in the future, with this push for education, we will have less of that and less long-term complications from there. So when it comes to the symptoms, we like to think of them as cognitive, physical, emotional, or sleep. So there's tons of different emotions or symptoms. And like I said before, each person's going to be different too. When it deals with cognitive, that means it deals with your brain. So you feel slowed down, you feel foggy, you have difficulty remembering, difficulty concentrating in class too at the same time. Some of the physical symptoms, those are usually the more common ones. So the nausea, dizziness, headache is a big one. Usually that's the #1 concussion symptom that people suffer. We get into balance problems too, lack of energy, those kind of things. And then concussions also affect us emotionally too. I've had student athletes go from crying 1 second to hysterically laughing the next, and they don't know what's happening. You can't control those emotions because of that damage to the brain. And then sleep is a big thing too. A lot of times student athletes with concussions will have troubles falling asleep or have problems staying asleep. So these are all really big keys that you need to look out for. If you do suffer some kind of head trauma or body trauma, that could lead to this. So when it comes to treatment, we really like to stress rest. We stress physical rest, so that means taking you away from playing, taking you away from running, really letting that brain kind of heal. Time is the best thing when it comes to concussion, just letting your body kind of take care of itself. We also like to stress cognitive rest too, so limiting cell phone use, limiting TV use. A lot of times if you have a concussion, we'll say don't be on your phone, don't watch a TV show or a movie, anything like that. And then the other aspect when it comes to cognitive rest is academics too. You guys are student athletes, so you're here for school to kind of succeed in that aspect too, academically.
Kind of.
Good, yeah, you are. So we want to make sure that we kind of balance the academic side with rest too. And Dan does a great job with this. I'll kind of let him speak on this aspect and how our two groups kind of work together.
With the academic piece, so just make sure that if you guys are diagnosed with a concussion, that you work with your professors, make sure that they're aware. We will particularly return to play and return to learn protocol, make sure that you're taking advantage of any advantages that are given to you through CAPS. A lot of times, if it's just like any disability, you can receive extra time on a test if you need it, or taking it in a room that's outside of your normal classroom. So make sure that your professors are aware of it, and then make sure sometimes the athletic training staff and myself and Aaron in our offices don't always communicate that, so make sure I'm aware of any concussions as well, or Aaron, or one of us.
Yeah, so the big thing is when you do suffer a concussion, we'll communicate with the academic side and kind of help you figure out that balance between appropriate medical care and rest, but also academic rest too. We don't want you falling behind in your classwork and schoolwork. So we definitely try and find that balance until you're cleared and able to attend class and do your homework without any issues. We also talk about emotional rest too and healthy behaviors. We want to make sure that you're getting plenty of rest, proper hydration, diet, everything like that. All those healthy behaviors can really speed up the process and the healing progression. So say you do suffer concussion, we do have to begin our return to play progression. So when it comes to the progression, there's 6 different phases or stages that we go through. The first stage is going to be no activity. That's where we're going to limit you. We're going to take you away from practices, from games, and it's not to punish you, it's we need to let that brain kind of heal and rest up. Once you are 24 hours without any symptoms at all, then we can go to the next stage, which is just light exercise. And at this phase, we're just trying to increase the heart rate. We're kind of seeing if those symptoms come back with some kind of functional activity like that. And then say you go through that phase and 24 hours later you still don't have the return of symptoms, we can progress to the next one. And that's going to be a little bit more sport-specific type stuff. I'll have my student athletes do plyometrics and sprinting, squats, a whole bunch of other stuff. So then that way we really kind of stress the brain, stress the heart, and the whole body system. You go 24 hours without symptoms after that phase 3, then you can progress to a non-contact practice. So this is going to be no scrimmaging, nothing where you could have physical harm to your brain again. And kind of keep an eye on that depending on the sport, your position, that sort of thing. Then 24 hours after that, so you stay symptom-free, we can do a contact practice. So that's a practice where you have no other limitations, and we really kind of test not only your ability to get through an entire practice, your confidence too at the same time. And then that way, if you stay 24 hours symptom-free after that, we can start to return you to a game or a more complete rotation from there. So the big thing that I really want to stress is that you can see this is a 6-day minimum progress. So we can't really cut it short or anything like that. So if you do go through a concussion, it's going to be at least 6 days before we can return you to play. And this is for your safety. It's not because we're trying to punish you or anything like that, but we're trying to limit some of those long-term effects that we talked about. Any questions with that so far? So a big question that I get a lot of times is how long does it take a concussion to heal? And like I said, each concussion is very different, so the progression of healing is going to be very different too. It could be up to 6 days to return someone to play, it could be up to a year or even longer than that. And again, that just depends on the severity of it, your outcomes, how your return to play progressed, everything like that. So, like I said, there's not enough research out there to say it's this long or it's that long. It really just depends on the person and that situation. So the big take-home message that I really want you guys to kind of know is that it's so important not to hide it. You need to report it. Let us know. We're here as your athletic trainers to protect you, keep you safe. You need to let us know. If you have a roommate or teammate or someone from another team that's maybe acting a little funny, has some of these weird symptoms, be sure and let us know too, and then we can kind of investigate it and go from there. And like I said, we want to kind of prevent those long-term issues, so it's really important to let us know, and then we can take it from there. So what did you guys learn? What's the big thing?
Don't hide it.
Don't hide it, report it. Thank you. Does anyone have any questions? Okay, so what we have to do now is